Yeah. Yeah. I wonder if giving pleasure and catharsis, if they are not also healing mechanisms, beyond medication or whatever. Just the idea of I feeling, catharsis, cleansed. That's what that means, and having pleasure into my life. That's just as powerful as taking a medication.
Yeah.
Wow, that's a profound idea. I never thought of that.
It's returning humanity to what has otherwise been co-opted. I'm using an aggressive word there. But returning humanity to what otherwise has been taken over by the medical realm. All right, the medical world is doing amazing things, but we can't all be specialists in absolutely everything. And there's a humanness that I think we're moving towards in the healthcare industry and in certain pockets of healthcare, which is to incorporate the full humanness, right? That's what the biopsychosocial model should be, incorporate the biology of the body, the psychology of the mind, and being a thinking person, and the social aspect of being a person in relation to other people. All of these will affect something. All of these things will affect everything at least a little bit. And this gets to some of the neuroscience of pain and understanding pain, which asks us to think of ourselves or our identity as being not just here along with what is here, but we're embedded within it. Like our skin is not the end of ourselves. We're the amount of influence we have from our surroundings, both socially, verbally, visually. We know that like UV light can be good until it's not, right? We know that oxygen's important, right? We know that other gases can be toxic. So okay, I'm in relationship to that. The air in me, is it me? As I breathe it out, is it still me, right? I have blood in me. If I get a paper cut and some of that blood comes out, when does it stop being me? And then how much of me do I lose before, I'm me or not me? And this is what keeps me up at night, which is identity. Where am I? Where is the me, right?
Yeah.
Right.
Now you sound like Walt Whitman. I'm many. I can't remember the Song of Myself. He talks about.
Yeah.
And even I was just listening to somebody talk about Rana Maria Rilke, a great German poet, talking about a similar idea. I'm circles. I'm involved in circles.
Yeah.
Kind of thing. And and I like what you said about the social way. That's often not thought about. Biophysical, social, that's biopsychosocial.
Yeah.
That we're embedded in relationships. Someone comes to see me. It's an individual who's got an individual problem.
Yeah.
And no, our problems are not individual. Our problems are, so to speak, are corporate. My pain might also be some kind of social phenomenon, not just me.
Yeah. Yeah, a lot of the public health research that looks at things like, family history of chronic pain or low back pain. Let's use low back pain because it's hyper simplified and it's not a simple thing, and we may never fully understand it. But there's research that says if your mom had really bad low back pain, then you're probably going to have it. And then in the scientific world, we kind of stick to that biological realm. We think, what is the genetic inheritance? What's the neurological factors? What's the immunological factors? And it would be a whole nother realm of research to say, okay, what are the social factors here? How do beliefs and practice influence our experience of pain? If pain itself is an unpleasant sensory and emotional experience, and it has to do with actual or potential damage, right? Then estimating potential damage and experiencing, a problem state of the body, You know, why can't that be strongly influenced by what we grow up with?
Absolutely. We talk about genetics and we think only in biological terms, but I see it as emotional terms. Every family is an emotional unit.
Yeah.
And I learned how to navigate life in my family. And if mom had chronic pain, I'm not saying I'm going to have chronic pain, but I'm going to know something about it emotionally. I think you're onto something extremely important, but it's often not thought about.